We call this segment Hot and Bothered. And, of course, we've had quite the heat wave in New England, as people around the country have. But there's nothing new. It's called summer. It's what happens every year. But it seems to me and to many that the number of physical fights have really spiked during this warm weather period. And one case involved a Winchester brawl on a beach. One car door hit another, and multiple people were stabbed, at least 5 arrested. These kinds of things are happening, it seems, more frequently. So we've asked a very nice lady to join us. Her name is Molly Muniz, Executive Director at Connections Wellness Group down in Texas with several locations. And here I am complaining about the heat, and you're from Texas, Molly.
Yeah, I'm getting irritated hearing you complain when I'm in Texas. So
I know. I've been... I know friends of mine who live in Texas, and they say it's unbelievable, and yet you put on a brave face, so that's good. Well, Molly, thank you for joining us. I know you have an extensive background in social work and in counseling. Obviously, you've got the hot weather, but it's more than that, and it's got to be post-pandemic stress that's still lingering. But how do you account for the violence that people are lashing out at each other with?
That's a great question. I think it's so important when we talk about things like what happened there is the context. What was the setting like? And there's so many contributing factors. Absolutely, the heat is a contributing factor for feeling irritable. But also, were they engaging in alcohol? Were they dehydrated? So there's a lot of factors that people come to a certain setting with that are internal. Maybe they suffer with anxiety and depression already, or PTSD, things that can kind of make us more irritable and have a shorter fuse. And so when you get all of those people together in one area and you add this massive heat and drought conditions, it's kind of like a ticking time bomb, if you will, and the heat can just be the igniter for that.
We also see it happening, obviously, on airplanes, a lot of enclosed spaces, and a lot of it had to do with the mask, no mask thing, and people just went bananas. But I'm just curious, if you're noticing in the counseling you're doing down in your state, a tendency for people to fly off the handle, anger and rage and road rage. Is that on the uptick?
Oh, absolutely. Yes, it sure is. And, in my clinic right now, we're seeing an increase in our admissions simply because it's August and school is starting. And, depending especially on your socioeconomic status, the cost of school supplies and school clothes and all of that can really add to the stressors as well and increase irritability. And, you talked about being on an airplane. You're in this enclosed space and you really feel like you have a lack of control. And that's definitely going to make people more irritable as well. We'll
talk, certainly, you and I, about some ways to curb this and maybe even self-control and developing that. But I wanted to talk a bit more about what's going on. We were just chatting about the economy and inflation and all the things that are happening, the price of everything, and Americans overall are feeling the pinch. That's got to add to the stress level in general, obviously.
Oh, definitely. Yes, it certainly does. We are seeing a lot of our patients who maybe even were doing really well. They had kind of stabilized and, they're coming back for additional treatment simply because they're fearful of not making their mortgage payment, or having gas even to commute back and forth to work because gas prices had been so high all summer. Thank goodness we're seeing those come down now. But on top of the day-to-day, we're having all of these extra things that people are having to worry about, and it's extremely stressful.
Talking with Molly Muniz, Executive Director down at an organization called Connections Wellness Group located in Texas. You've got lots and lots of clinics, and that's important to give people the opportunity to get help. Is it mainly younger people? Are you noticing, say, middle-aged to upper middle-aged folks also exhibiting the short fuse and having issues with this?
Yeah, I've seen it in all ages. as young as 7 years old, and as I think the latest one that I've worked with was 52. So yes, the short fuse and the stress doesn't care what age you are. It presents in everyone. So we're just seeing it across the board in all age groups, which is why I'm thankful we have so many locations, each one serving different populations and different ages, so we can try and meet the needs of the entire communities we serve.
Well, we're up here in Boston, and our signal travels far and wide, but, Boston is renowned for having lots of clinics and medical opportunities, but still things happen, and we're not even talking about the crazies who shoot up schools. That's a whole other issue. We're just talking about ordinary, talking about ordinary folk who just fly off and drop the gloves. That's the thing that's really amazing to me, how quickly somebody's ready to slug it out with somebody else.
Right. Yeah, sure. And I think it goes back to that fight or flight response that we have, the short fuse, if somebody has a history of trauma, those small things that can seem so minor, like dinging someone's car with your car door, it can produce such harsh and large reactions. And so, yes, I can definitely provide several stories of those reactions that just seem so manageable, and yet they turn into something much larger than anyone anticipated.
So I'd love to offer the audience, the wide audience here that Dan Ray cultivates, that's the regular host, I'd like to offer them some hope and some thoughts on how, without the help of a clinician at the time, in the moment, how we can sort of defend ourselves from ourselves getting involved in this kind of crazy activity, and how to deflect or sort of bring down the heat on the other side. Any thoughts?
Sure. Oh, absolutely. Mindful pauses are really, really powerful. You have something that triggers your emotions, and before you react, trying to just give yourself a moment to be silent and really think about what you're trying to gain from your reactions, and trying to quickly process what those potential consequences could be. So we call that a mindful pause, where you look at it and you learn from it, and you kind of play out different scenarios. And this all happens fairly quickly in your mind. And normally, along with some deep breathing, that can really help you kind of calm down and make a better choice.
Well, it's interesting, getting back to the road rage issue that everybody knows about. We know what it means. We know what it is. It's so tempting when someone's in a car that weighs 4,000 pounds to honk the horn and raise a certain digit on your hand and just act tough. I've come up with I must be doing something right, because I occasionally get honked at and gestured to, and I come up with a totally different reaction. I smile and just keep going. And boy, is my life a lot easier. I used to get mad and used to fire right back, but because you hear about people whipping out a gun or a knife or throwing a rock at your windshield and just getting out of hand. So I couldn't agree with you more. The pause is terrific.
Absolutely. And it takes some practice, but then it eventually becomes a really positive habit. So definitely. And one thing, Jordan, the whole road rage, when you're driving and someone cuts you off and you throw up the digit or honk the horn, or you're on the receiving end, there's so many layers to that irritability. They're probably processing their day. They're thinking about work, how they have to go home for their most important second shift of the day. And then that little cutoff or whatever it may be on the road is just kind of too much for them at the time. So, yes, there's always more to the behavior for sure.
Yeah, if you think about that, if you're not the one who's perpetrating the violence or wanting to, but if you're the one on the receiving end and you're just sort of standing there and you might be in the way, if you think about what that person might be going through at that moment, doesn't excuse the behavior, but at least it gives you pause to understand what's going on. What about the person who is, the innocent bystander, the poor schnook who's standing there with an ice cream cone and somebody starts ranting and raving? What do you do? Is it just basically avoid eye contact, move away? Do you get involved? What do you say?
Right. That's a great question. I think you always have to assess for safety. And if you feel like you can be safe and, have a dialogue with them that's going to be productive, then yeah, you can definitely do that. If you feel like, you know what, I can't rationalize with them because they're being so irrational, the best thing would be absolutely to just walk away and maybe even do what you do, Jordan, and give them a little smile and a wave and just move on and exit that situation.
Yeah, I'm very good at moving on. It's one of my strong suits. Let's do this,
Well,
a very quick timeout, and then we have a couple of callers who might want to join us. And this is
great.
and so it's so nice of you to come on board, Molly. This is a universal topic. It affects everybody on the planet, living or non. Everyone's gone through this sense of getting ticked off, but it's gone a little bit cuckoo in the summertime, and we're trying to defuse. We're talking on the line with Molly Muniz, Executive Director of Connections Wellness Group in Texas, counseling centers that are helping people with what we're talking about, which is anger issues and the uptick in violence among neighbors and stuff. Let's go to some calls for you, Molly. This is David in Hoover. David, hello. You're on WBZ with Molly and Jordan.
Hi, guys. Thanks for taking my call. So I'm a licensed mental health counselor in the state of Massachusetts. And I've worked in clinics and hospitals, outpatient settings, inpatient settings. And with regard to anger, I think anger, from a clinical perspective, is best viewed sort of as a secondary emotion. No one usually goes from zero to angry. There's usually other emotions that are happening beforehand, right? And it's usually at the subconscious level. So what you normally have is someone who is no longer, they're in a dysregulated state, and they're no longer in a position where they can think more rationally, right? Their executive functioning kind of alters and changes quite a bit. And so what I have found is, in my practice, is that one of the main issues that drives these anger issues or aggression issues is just a lack of what we call distress tolerance skills or simple self-care. A lot of folks these days, it's hard to come by just simple self-care. People are overtaxed. A lot of these angers behaviors are displacement behaviors. So people aren't really angry at what's happening. They might be upset over something else, like you said earlier, Molly.
Molly, you want to comment to David? Go ahead.
Sure. Yes, David, thank you for chiming in. I really appreciate it. And you're exactly right. When we get to that secondary emotion of anger, your focus really narrows and your perspective is extremely limited. And you're also, you have this overwhelming feeling of self-righteousness and power. And so I'm definitely with you. You hardly see someone go from zero to angry. There's a bunch of steps in between. And Jordan, you said earlier some self-tips for people that don't see a clinician. You can do a simple Google search for behavior chain analyses. And it really helps you kind of identify all of those behaviors and precipitating events that lead up to that emotion of anger in this case. And that can be really eye-opening. And so, David, you're exactly right. And thank you so much for the work you do out there in Massachusetts.
David,
thank you as well. I think another quick point, a lot of the issues stem from a lack of introspection and self-awareness. So people aren't exactly aware of what's happening. So the more they learn about themselves and the more tools they have, the better off they'll be. Thanks for your time, guys.
Thank you, David. Very good of you to call in and offer your expertise, really. And I have so much respect for people who do the work that you and David do, Molly, because it's hard work. It's dedicated work, and not everyone is got the patience or the abilities that you do. So let's go to another call here before we wrap up. This is Linda checking in on line 6. Hi, Linda. You're on WBZ with Molly Muniz. We're talking about anger at the moment.
Hi. I've been the recipient of a fair bit of anger. Tend to be I'll take it, leave, and deal with it for months, years, sometimes decades in one case here. Someone said a hurtful thing and I didn't feel comfortable to approach the person again.
Mm-hmm.
I had a stint in the hospital, claims, and had put it besides trying to work on still putting closure. And someone else had snapped at me, and I want to forgive, and I have forgiven, but I just don't feel comfortable one-to-one facial type thing. I keep dealing with in the postcard with just a couple of lines and leave it be.
We have a bit of a time constraint, so I want to get Molly in here,
one more
obviously.
thing.
Yep.
There was a woman on the street who gave me the middle finger.
Yes.
And I wrote a note to her, and I said, I saw the finger, and I raise you one. Peace. Peace out.
That's a very good answer. I raise you one piece. That is terrific. Linda, listen.
There's no copyright on that. Go ahead and use it, anybody.
Thank you very much. Just a quick comment for Linda's sake and for anyone else. It sounded like she has been dealing with, and she has self-admittedly been dealing with it professionally, some serious trauma. And the impact of trauma on anybody can be huge. Isn't that right, Molly?
Yes, that's exactly right. Linda, first off, I want to tell you I'm so proud of you for being introspective and recognizing these things that you are working on through writing. That can be very therapeutic. I'm proud of you also for seeking help at a hospital. That takes a lot of bravery and courage, so I just want to validate you in that sense. And, you know, avoiding and suppressing our anger is not a good thing. In the moment, you may feel like it's the best, but long term, that anger is going to live in your head rent-free. And so don't let it steal your joy any longer and continue to seek help. I think everyone could benefit from a therapist. I'm a therapist. All the therapists I know have our own therapist. And so I'm really proud of you, Linda. And I'm going to steal that for those road rage incidents on these Dallas highways, and I'll raise them one as well.
Let's see if we can squeeze one more quick call in here. Roberto is on the line. Hello, Roberto.
Yes, hi. I just have a question about intermittent explosive disorder. If you could kind of elaborate and get into that in your view on how to deal with people that have it. Thank you.
All right, thank you very much. Intermittent explosive disorder.
Sure. So is Roberto still on the line? Can I ask him if this is something?
No, he's left to just hear a brief answer in general. So.
Okay, gotcha. Okay, so yeah. IED, intermittent explosive disorder, is extremely difficult to be on the receiving end of that. And quite honestly, for the person that's exhibiting those symptoms, it can be exhausting for them too. And it all goes back, Jordan, to trauma. That person probably grew up in an environment that wasn't very nurturing, and they saw those explosions, those outbursts of anger, felt very unsafe, I'm sure, as well. And so that person really needs to seek help, medication management, and also therapy.
Indeed.
So that would be my biggest thing.
Indeed. There's so much we could explore. Time is not on our side, but you've been so nice to come on. We found a connection with you from Connections Wellness Group in Texas, and I'm so glad we did. It's nice to talk to somebody who's so caring. Thank you so much, Molly, and good luck.
You're welcome. Go Red Sox.
Oh, good. Thank you. Thank you very much. We could use all the help we can get. Thank you to Molly Muniz, and we talked a little bit right there about anger and these incidents that are cropping up, and it's important to do that self-reflection.